Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Urinary system imaging. So first is, let's look at the cobra head. The cobra head or the spring onion deformity. Spring onion deformity is nothing but the uterocele. The ureter is dilated and at the inserting point into the bladder. So it is dilated at the inserting point at the bladder. Then is the flower vase. The flower vase appearance, it is aka the joining hands or the handshake appearance. So this is basically, it's seen in the horseshoe kidney. Next is the spider leg appearance. The spider leg is seen in case of the polycystic kidney disease. Then comes a golf hole ureter. Golf hole ureter. The golf hole ureter is seen in case of the TB urinary bladder. Next, moving on to the thimble bladder. So there's something but the thimble bladder. The thimble bladder is nothing but a small contracted. It is a small contracted bladder and it is seen in case of the TB. Then the TB urinary bladder is also seen. Next, looking at the fish hook or J-shaped hockey stick ureter. J-shaped hockey stick ureter. So here what happens is, this is due to the enlarged prostate. So this enlarged prostate is seen and it projects into the bladder. It projects into the bladder, which causes the insertion. So as the insertion of the ureter to become elevated, giving rise to the fish hook appearance. So this is seen in case of BPH, and then we move on to the chalice or the Bregman sign. So what is meant by the chalice or the Bregman sign? So chalice or the Bregman sign is basically there is dilation. So chalice and the Bregman sign, there is dilation. So chalice, Bregman, there is dilation of the ureter. There is dilation of the ureter. That is, there is to neoplasm and it is not seen with the calculi or the thrombi. Next is the rim sign. So in case of rim sign, that is a severe hydronephrosis. Severe hydronephrosis is seen. And when you look at the rim and the ball nephrogram, and this is on the IVO, you look for the chronic obstructive nephropathy. Then looking at the soap bubble appearance. So soap bubble appearance is severe hydronephrosis. And looking at the goblet sign. Goblet sign, it has a focal dilation of the ureter. The focal dilation of the ureter by the intraluminal mass. That is the most common in case of the transitional cell carcinoma of the ureter. Now we look at the bladder calcification. So here in the bladder calcification, it is present in the lumen calculus, foreign body, and involve schistosomiasis. That is the bladder calcification. Classically resembles the fetal head. So it resembles the fetal head. And the TB, the transitional and the squamous cell carcinoma, and also the cyclophosphamide induced cystitis. Then we move on to the duplex renal collecting system. So in case of the duplex renal collecting system or the duplex ureter, there is a drooping lily sign. The drooping lily sign is a compression of the lower moiety of the calyx, and the differential diagnosis for the drooping lily sign is upper pole renal mass. So upper pole renal mass or the cyst. Then there is a Weger-Mayer rule, which we need to know. Weger-Mayer rule. So Weger-Mayer rule is when there is a complete duplication. That is the lower pole ureter. It normally inserts, the lower pole ureter, it inserts into the bladder, and also the upper pole. So it inserts into the bladder as well as the upper pole of the ureter, ectopically into the bladder medially. So medially, and caudal to the insertion of the lower pole ureter, and it is caudal to the insertion of the lower pole of the ureter. To learn and grow daily like this, please do subscribe.